Hi, good morning Samuel. My name is Molly Milan. I'm your invigilator for the OET speaking session on the 8th of April 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Samuel Fernandez.
And what is your candidate number, please?
My candidate number is 212801119.
Thank you. And you are taking this test as a doctor. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What are the roles of a doctor?
Doctors mainly restore the lives of their patients using medicines. They examine the patients for any illness, review their medical history, diagnose the illness the patient has, and give them treatment. The doctor then educates the patient on their health and well-being. They also collaborate with other doctors and healthcare workers to improve the quality and safety of patient care.
What are the qualities that a doctor should possess to be effective?
An effective doctor should be empathetic and caring to save the lives of the patients professionally. He or she should also be skilled in their field of specialization and use evidence, intuition, and method to ensure faster services to the patients. Doctors should also keep their patients' medical history private and not share it with anyone else unless they allow it.
Describe your daily routine as a doctor.
I start my day by organizing all the workloads and undertaking patient consultations and physical examinations. I then perform surgical procedures, if needed, and also lab tests for some patients. After that, I offer general pre- and post-operative care to the patients, and then monitor and administer medications. Additionally, I assess other patients and plan their treatment requirements.
What are the unique skills that differentiate you from other doctors?
I care a lot about people's lives, and I am always cautious and extra careful while treating them. I never treat a patient based on assumptions and then predict the medication. I always conduct lab tests on the patient to ensure the conditions they have. After that, predict the appropriate medications and ensure they take them accordingly.
What kind of mindset and strategies is required for this role?
A doctor needs to constantly research new medical advancements to ensure they give good and effective treatment. He or she needs to be curious to know new trends in their field and implement them. The doctor should also be compassionate and ensure to save as many lives as possible. In addition to this, he or she should work together with colleagues to ensure they offer excellent treatment to their patients.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OIT speaking role play. Don't worry if I stop you when the time is up.
Good morning. I am Dr. Samuel Fernandez, one of the doctors in the clinic. Can I have your full name and age for the record, please?
Good morning, doctor. My name is Molly Milan, and you can call me Molly. I am 76 years old.
All right, Molly. What brings you here today?
Doctor, I am having severe pain in my right hip. I need your help to overcome this.
I'm sorry to hear that. Can you please tell me in detail what exactly has happened?
Yes, doctor. I have had pain in my right hip for years. Recently the pain has become more intense, and it is affecting my ability to perform everyday movements and tasks.
All right. Did you try any remedies?
Doctor, I have recently started using a walking stick to maintain mobility.
All right. Haven't you taken any treatment since the pain started?
No, doctor. I haven't taken any treatment so far.
I acknowledge that. But Molly, I would like to inform you that, whenever you feel any abnormality, it is always safe and better to be consulted at the right time.
Sorry, doctor. Unfortunately, I didn't get consulted. And now, I am worried about what exactly is the cause of my increased pain, and likely treatment recommendations.
I understand your situation. Try not to worry. For your better understanding, I can explain the possible causes of your symptoms. Molly, there are various causes that can affect this, including osteoarthritis, which is most likely to be affecting you. Other causes can be bursitis, tendinitis, and even referred pain in the back.
Oh, I see. Why is the pain getting worse, doctor?
Your concern is quite reasonable. There are several reasons for the worsening symptoms. Most probably, it can be due to the cause remaining untreated. So, gradually the condition worsened, and is affecting you badly.
Is this problem common?
Yes, Molly, it is a common problem. Hip pain is quite common in people over 65. The most common cause is found to be due to arthritis.
What should be done to diagnose my problem, doctor?
Your question is very appreciable. Your condition can be diagnosed by physical examination first, and thereafter, X-ray can be performed to rule out the possibility of arthritis. These two examinations are required for the diagnosis in the first stage.
All right. Doctor, what treatment might follow afterwards?
Your thoughts are sensible. Let's discuss the treatment options now. Firstly, you have to understand that the treatment actually depends on the diagnosis. According to the condition, the treatment method will vary. For your better understanding, if you are diagnosed with arthritis, we will initiate weight loss techniques first, along with modification of activity and habits. For pain relief, paracetamol and NSAIDs will be provided. You also have to perform physiotherapy for better recovery.
All right. I understand that.
Moreover, you will be referred for hip replacement surgery, if these conservative treatments fail to show the progress.
Oh, I see. And doctor, what should happen now to my pain?
Definitely, Molly, I will guide you through the current procedure. Like we discussed now, the initial step is to find out the reason behind your hip pain.
Okay.
Therefore, we can begin with the physical examination. Afterwards, for further diagnosis, X-ray can be performed today. You have to wait for the diagnosis report for the follow-up treatment, since it is based on the confirmation of the diagnosis. I hope it is clear for you.
All right, doctor, I got it.
Your treatment plan will be finalized only after the confirmation of the diagnosis. Once the treatment has begun, you will be monitored on a regular basis to evaluate the course of action and to make necessary changes accordingly.
All right, doctor. It is clear to me now.
Good to hear that. Well, Molly, now, I need your consent to proceed with the physical examination.
Sure, doctor. You may please proceed.
Thank you for your consent.
That is the end of your OIT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.